Okay, so if you have arthritis and if you're wondering if a joint replacement is required because of your joint pain, this is the video for you, because I am going to go through not only what makes you appropriate for joint replacement surgery, but answering that hot question of if it is required or not. So if you like this channel, go ahead and hit that red subscribe button below so you can get updates on all of my new videos. And also, if you do find this video helpful, go ahead and hit that thumbs up button so that way the more people that like it, the more people that will be able to see it on YouTube. So without further ado, we're going to get right into it, and I'm going to answer, is a joint replacement required if you have arthritis? And the short answer is no. So that's going to bring you some hope that just because you have arthritis does not necessarily mean you're going to have a joint replacement. So, and that is kind of contrary to popular belief. If we start to talk to friends, if we start to do research online, we find that joint replacements seem to be common and they seem to be normal if we have arthritis. But that is not the case. So I want to talk to you about first what makes you appropriate for a joint replacement surgery and maybe when you should consider it. And then also we're going to talk about the prevalence and stuff later. So first, I'm going to talk about a study that looked at the appropriateness of, and this is just looking at knee and hip replacements. So this is not necessarily considering the shoulder. Those are kind of the three typical ones, but knee and hip are usually the most common joint replacements. So this study looked at how to determine if somebody is appropriate for a joint replacement, because there's not really any objective thing that we can kind of go through to check these boxes, and if you check all these boxes, then you need a joint replacement. It does kind of vary on the person and the situation, and then also the severity of the arthritis itself. So what this study looked at was figuring out what are the most common things that people consider or the most limiting things with arthritis. And so obviously the number one is pain. So pain is usually the most limiting thing with arthritis in general. But what they looked at is about 5 or 6 questions or considerations that they recommend that we look at in order to determine if we're appropriate for joint replacement surgery or not. So I'm going to tell you a couple of those. So the first one, so they used a scale of none or mild, moderate, and severe. So that's what we're going to think about with these questions. So the first one is pain in motion. And so pain in motion really is at your activity. So have you given up the activities that you love? And so none or mild is you haven't really given up any activities, but you just have pain and it's just kind of there, but you haven't really modified anything. Then the moderate range is going to be you've started to kind of give up some activities, but you're still able to do some of the ones that you typically do. So moderate is you're about moderately limited. And then severe is kind of you've given up everything that you typically do, and you're not necessarily doing a whole lot of activity because of pain. So the second one is then walking limitations. And so this is primarily talking about walking distance. So if you're limited in the amount of walking you can do. And so I think that they measure this with time, and they also measure this with meters. So the none or mild, I think it's you can walk over an hour and not really, you notice the pain, but you can keep going if you needed to. You can, walk to the grocery store, walk in, go hiking, whatever it may be. And you don't necessarily really have much difficulty, it's just the pain is there. Now, the moderate one is you've started to kind of limit your distance. You can only walk about 30 to 45 minutes, and you notice the pain, but you could keep going if you needed to, but at kind of about that 30 to 45 minute range, you either need to sit down or stop the activity. And then the severe one, I believe so the numbers are in this study, and I will link this study in the show notes below. I believe it's only about 15 minutes or so. So you're severely limited. So you really have to kind of rethink all of your activities. You really have to kind of conserve your energy and only do certain things where you only need to walk a certain distance before you need to stop or sit down. So that's the severely limited. So the third one is pain at rest, and this one is primarily talking about sleep. So if you think how your arthritis pain affects your sleep, and then so pain in motion, you have some, or pain at rest, you have some limitations, some pain, but it doesn't necessarily wake you up at night. You notice it sometimes, but it doesn't consistently. Moderate, it wakes you up every once in a while you're sleeping. It does kind of affect your sleeping patterns, and it is starting to become kind of a nuisance. And then severely, as it really impacts your sleep, you're not able to get good sleep. And this one is interesting, and I'm glad that they put this in here, because sleep is one of the biggest drivers of our energy levels throughout the day. Sleep really kind of dictates how good or bad of a day we're going to have and what we can get done, etc. So it can really affect our mood and things. So this is a big one. And so if your pain is affecting your sleep, this is something to consider. So we have those three. And then they also look at, so like I said, each person is different. And so if your pain is limiting you, and so you can't go hiking, or you can't, do some of the leisure activities, a joint replacement surgery may be appropriate for you, if that means a lot to you. So if that's something you absolutely want to do, if that's something that really gives you happiness and really drives your mood and quality of life, then a joint replacement might be appropriate. Also, say you have to care for a loved one, or you have to do some demanding job that you really can't afford to quit, or really can't look for a new job. Your life kind of depends on you to be able to do this. So there's lots of different situations where you really have to kind of think about, okay, if I were to get out of pain, could I do these things, and would I do these things? And also, is it truly impacting my quality of life? Is this pain kind of driving the activities I do? Is this pain really affecting my happiness, essentially? So those are kind of the first three things to consider. If you're answering severe to all of those, then a joint replacement surgery may be appropriate for you. Now, this study also looks at some physical measures, like with a physical examination to see your range of motion and those sorts of things. So they don't necessarily just take into consideration those questions, but there is also a little bit more that goes into it. But that's kind of the main things that we can easily relate to right now. So then I added my own questions. So there's a couple of things that I worked in home care seeing patients the day after total knee and hip replacements. And one of the biggest things that I found, and that's why I created these next three questions, because I really want you to think about it. So the first one is, are you willing to put in the work for the recovery? So especially with knee replacements, you have to really work at it in order to get the best results. Range of motion is huge for knee replacements, and so is movement. And if we're not super motivated to get that range of motion back, to work with the physical therapist, to get work in that rehab and give it your all, not necessarily just twice a week, but it's an everyday thing. We have to realize that there is some work involved, because sometimes people think, surgery, it could be, the easy way out. It is still surgery, but we have to be willing to put in the work. And I know a lot of people have told me after they've had surgery that, like, if I knew this was going to be this much work, I might not have even done it. So, and it's not necessarily just the work. There is some pain involved as well. So there is some pain with most surgeries. And so that's something to also take into consideration. So the second one, will this joint replacement improve your quality of life? So like I was mentioning before, if your knee or hip pain is really limiting you to the fact that you have given up everything, you want to get back to walking, you want to get back to some sort of physical activity, you want to get back to maybe even hiking or cycling or any of these activities, you are really motivated to get back to something. So for me, it's a little bit more than just getting out of pain. I want to see people move, because that's one of the biggest things. If you get a joint replacement surgery and then you just kind of hang out and you just kind of sit around and are pretty sedentary, your results are going to be kind of iffy. So it kind of goes back to number one and kind of ties into, you really have to be motivated to keep moving after you get this joint replacement. So like I said, if you're just going to get this joint replacement and then just, kind of remain sedentary, then this might not be the best option for you, because you have to move in order to get the optimal results from this joint replacement. So it's finding some sort of activity that you like. You have to be willing to start moving more, because then that joint's just going to get stiff. Then you might need a manipulation and then all of this stuff. So just because you get your joint replacement doesn't mean that you don't have to work. So if you're going to pick up some sort of activity or really start to focus and hone in on getting at least some exercise or some activity, then a joint replacement might be a good option for you, because it's going to decrease that pain but also allow you to increase your movement. But you have to be willing. And the third one is, have you given a good effort to conservative management? I know a lot of people really push for obviously avoiding surgery. Surgery is not necessarily anything anybody is wishing for, but sometimes people kind of use it as an escape. So have you really given good efforts to eating right? Have you really given good efforts to some quality physical therapy services? And that's why I provide premium services in-home, so that way we can really kind of get you that quality service. And so have you really given a good effort to that? And if the answer is yes, then that is totally fine. Sometimes conservative management doesn't work, and that is totally okay. And a joint replacement surgery might be something worth looking into. So conservative management isn't perfect, but I know a lot of people that have luck with it, and a lot of people that are able to actually maintain their pain, kind of keep it at a stable level so it doesn't necessarily limit, and they're kind of living in that none to mild limitations. But then there are some people that just have that severe pain and can't get out of it, and that's when surgery is appropriate. But I know quite a few people that have gotten into this surgery too prematurely without trying some of these other things. Because I once heard that the only surgery that doesn't have any risks is the one that you don't get. So any surgery is going to come with a degree of risk. So it's just something to keep in mind. So then we have to kind of weigh the positives, or weigh the risk and the reward. And so that's why it's kind of a multifactorial decision, that it's not necessarily, is your pain limiting you? Okay, we need a joint replacement. Is your pain limiting you to the fact that it's really impacting your quality of life? If you're starting to feel depressed, anxious, stressed, and you just really cannot get out of this vicious cycle, then that's going to contribute to that decision. And if you can go through these questions and kind of figure out and see where you're at, and then we can try some of these conservative management as well. Because there's one study that I really want to mention. It was a study done in Spain of around 8,000 people. And these 8,000 people, 7.4% of those had hip osteoarthritis. And out of those 7.4% with hip osteoarthritis, 37% of men were appropriate for a joint replacement, and 52% of women were appropriate for a joint replacement, using the scale of the questions and things that I had mentioned. But then if you look at the knee, so 12.2% of those 8,000 people had knee osteoarthritis. 11.8% of men were appropriate for a joint replacement, and 18% of women were appropriate for a joint replacement. And that's 11.8% and 18% of that 12.2%. So it's not of that 8,000. So it's a relatively small number. So if you're looking, less than 20% of people who have osteoarthritis in the knee are appropriate for a joint replacement surgery. So a joint replacement is not required. You just have to look at the fact, is it limiting your life to the point, like I said, where you're depressed, you just have all these negative emotions, you're not able to do the things that you like, you're starting to become more sedentary by giving up all of your activity, and when that happens, you start to welcome all other kinds of chronic diseases, diabetes, obesity, depression, all of these chronic diseases, hypertension, heart disease, all of these things. So if your joint replacement, or if your joint pain is limiting you from these things, then a joint replacement is something you should think about. But it's not something that you can just make a simple decision about. So we have to try those conservative management strategies first to see if it can get you some relief. And then we try changing our diet. There's all sorts of things. I always say osteoarthritis management is a team effort. So we need a nutritionist. We need a physical therapist. We need a good rheumatologist or a good primary care physician that's really going to understand and push for you, advocate for you to do these things. But it does take action. And so joint replacements are not usually the easy way out. And it's not an easy decision. It's expensive. There's a long road to recovery, which typically is about 3 to 4 months. So there's a lot to consider with a joint replacement. And if you think about those 3 questions, so do you have pain and motion? So that's your activity level. Walking limitations, and then if you have pain at rest or it's affecting your sleep. Those are kind of 3 big things to really think about. And then also think about some of those other things. Are you ready to put in the work for the recovery? Are you ready to get back to activity and start moving again to get the best results from your joint replacement? So we have to be ready. And one of the things that people really were talking about after they had gone through these surgeries is they had no idea what to expect. And so there's a lot that goes into the rehab for it, and a lot that we need to understand when we are recovering from a joint replacement that, again, a lot of people weren't very educated about. And that could be their surgeons not educating them. That could be they're just not seeking out information. It could be a lot of different things, but sometimes we just don't get the information that we need. And so that's super important. So before you decide on a joint replacement, definitely get all the details you need, whether it's talking to your surgeon, whether it's talking to a physical therapist. And that's why I kind of offer that one-on-one long-term service, because I want to help you in the long term. I want to help you answer all of your questions, because one of the biggest things is people don't know who to ask, who to turn to, and then they turn to the internet, which might not always be reliable. So that's why I am providing you all of this information to really help guide your decision making so that you make the right decision for you. Now, I'm not trying to demonize surgery. I know a lot of people that have had a lot of success with a joint replacement. It's just very dependent on the person, and you have to be willing to put in the work for it. But I also know some people that haven't had much success, and that's because maybe we're not doing activity, maybe we're not putting 100% into the rehab. It could be lots of different things. But it does depend on the person. So there's not necessarily certain checkboxes, like I said, that we really have to go through. It depends on the person, and it depends on your situation and what you're willing to go through. So if you have any questions, visit me at www.keeptheadventurealive.com. I also have a blog post that I wrote on this as well that you can access down in the show notes below. So if you found this video helpful, go ahead and hit that thumbs up button and put a comment. Let me know what you found interesting, what you learned, what you're worried about for a joint replacement. Let me know in the comments. So just put a comment below, and then also hit that red subscribe button so you can get updates on all of my new videos. But again, my name is Alyssa with Keep the Adventure Alive Physical Therapy and Performance, based in Salt Lake City, Utah. I really hope that this video was helpful, and thank you so much for watching.